Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today I have Dr. Stephanie O'Brien. She is a chiropractor in Decatur, Georgia, which is right here in the Atlanta area. She specializes in family wellness and says if a nerve is involved, it warrants chiropractic evaluation. She's been in practice for 26 years and she likes to participate in the local community. I love this slogan, Dr. Stephanie, that you have on your email. You say, everything is possible. I love that. Welcome to the show.
Thank you. Thank you. Yes, I came up with that a few years ago because it was really what I needed to read every time I sent out an email. So,
really? Well, that's a good view to live your life by. Everything is possible. So tell me a little bit more about yourself and your business of chiropractic. Tell me how you got started in chiropractic 26 years ago.
Well, 26 years ago, I graduated from chiropractic school. And before that, I lived in Miami. And I came from, my grandmother was a nurse. All my aunts were nurses. My uncle was a medical doctor. Hadn't really heard the word chiropractic. But as I got older, I just got more and more curious about it. And every time I went to a community event, I would talk to the chiropractor. Never understood a word they were saying. But their passion was so fascinating to me. And I was just in my early 20s at the time. And then one day I finally went to a chiropractor and they said that the body was intelligent. And I thought, well, how do you argue that the body is stupid? Well, there's no proof that the body's stupid, so it must be true. And my family was very, very dedicated, in healthcare. But there was never a conversation around our table about how smart the body was and that there's this wisdom that keeps us healthy that's already in our body. That was not part of the conversation. So when that idea came to me, I thought, well, that must be true. And it took several years of me following, just getting adjusted regularly. It took a long time for me to decide to become a chiropractor. I wasn't ready just because I fell in love with it to be a chiropractor. But after a couple of years, I thought, okay, that's what I'm going to do. And I always thought I was going to be an architect. And of course, a lot of chiropractors have an engineering background because of the design of the body. And so it's like, oh, that's why I always thought I was going to be an architect. I'm a human architect. I'm not a building architect. So...
Excellent. Well, chiropractors are definitely a passionate bunch. They are very invested into what they do, and they care a lot about their art. But tell me a little bit more about who it is that you like to help. I know there's some chiropractors specialize in, specific things. Who have you found that you like to help most over your years?
So the majority of my practice members, and we don't call them patients in my office because that kind of creates a hierarchy of doctor-patient. So we call them practice members because then that puts us on a level field of, you're hiring me as your chiropractor and you are my practice member rather than a doctor-patient kind of thing. So most of my patients come in regularly just to get adjusted and stay well. And then when they leave, they go on with their life and they function optimally. And really that's what health is all about, is optimal function. It's not just constantly putting out fires of this health problem and this health problem and this health problem. That's not how we're supposed to live our life. So new patients find me, usually they do have some particular problem, but very quickly they realize, the problem is secondary to the fact that my nerve system has not been expressing optimal life, which is really the term we use. Your nerve system is who you are. Like when we die, nothing leaves except that spark of life that's in our nerve system, which we call human electricity.
So let's talk a little bit more about what exactly chiropractic is, because, there's definitely some misconceptions about it. It's not just cracking the bones for people with low back pain. Give us a more in-depth realization of what chiropractic is and who it actually helps.
Well, when I do my new practice member orientation, I cover a couple of different things. Why do you want to be healthy? What health really is, and understanding that health is not how you feel, it's how you function, and your nerve system controls every function in your body. So if you were to think about any electrical appliance in your house or even your cell phone, and if it's not working right and you go to troubleshoot it or you take out your manual, the very first line in troubleshooting says check your power. So if it's your refrigerator, they say make sure your plug is plugged in. If it's your phone, they tell you to power it down and turn it back on, or power it down and take out the battery and turn it back on. So everything is about power. But in our body, we don't check the power first. So if our kidneys aren't working right, we don't say, oh, is the electricity going to my kidney functioning properly or not? We just throw chemicals at it or we remove it. And so if there's a vertebrae out of alignment, like around your waist, say maybe just a little higher, the nerve exits the vertebrae there, goes to the kidney. And it tells the kidney what to do, and then the kidney gives feedback back to the brain what's happening. So if there's a miscommunication, just like static on the line or, a power outage, how can that kidney work right if it's not getting full power and full information from the brain? And so we look for something called a subluxation, which is spelled S-U-B, which means less than, and then L-U-X, which means a misalignment. So it's a small misalignment of the vertebrae, which then it's like a circuit breaker kind of off, or like a dimmer switch turned down, not allowing all the power or electricity that comes from your brain, your life electricity comes through your brain, from your brain down your spinal cord and out those nerves. So chiropractically, we're not concerned primarily about your back or even your vertebrae. We're concerned about your nerve system, because it's the nerve system that controls everything in your body. And we know if your nerve system is clear, you are going to express as close to 100% of your life potential as you are. And so people are walking around, I don't try to quantify it, but if people are walking around at 80%, you could see why there's some dysfunction in our culture and people not expressing optimal health. And then the whole system is, we'll wait till you fall apart, and then we'll either drug you or cut it out. It's never about, well, why can't I just express optimal health for 100 years? Doesn't that make a lot more sense than waiting to fall apart? And disease right now is really marketed. So we believe more in disease than we believe in our body's ability to heal itself as a culture. So that's kind of part of the problem. They really get into people's heads and market really well to them that disease is more real than health.
Right, that's an awful shame, but that was an excellent definition and understanding of what chiropractic is. It's not just a simple fix, it's working on a whole system, and you're working with the most advanced system that was ever developed, being the human body.
Correct. And so when people crawl into my office with back pain, you can see how, say they're 25 to 40, which is pretty typical. I know they've had 25 to 40 years of wear and tear on their spine. They think it was just, I bent over yesterday and picked something up and now I have this pain. But I know that that's the last straw. And, imagine, like if you went to a dentist at 25 to 40 years of age and had never really taken care of your teeth properly. And you said, okay, I have this toothache. And the dentist says, well, yeah, you have an abscess there, but all your gums are diseased and your teeth are rotten and you need extensive work. And you'll go, well, no, it just hurts right here. But we don't do that in our culture. We take better care of our teeth. And that's because we had a belief system changed. And so when I'm taking care of people, it's not just I adjust them and send them on their way. They have to choose to understand why I'm doing it. so that they can choose optimal life. Because when in my grandparents' day, I mean, they were very educated people, but they didn't want their teeth to outlive them. So when people died, if they had all their own teeth, they thought that they didn't live long enough. And so it didn't bother them to go to the dentist and have a tooth pulled. So imagine now here 100 years later, if we still had that belief system, well, we just wait till our teeth rot and have them pull, we would have no teeth, right? But I meet people all the time in their 70s that learned at an early age to take care of their teeth, and they still have all their own teeth.
Right.
And so the dental industry was able to get into people's minds and change people's paradigm or their belief system about taking care of their teeth. And so now dentists don't just pull teeth, they help you take care of your teeth so they last a lifetime.
And how has the chiropractic industry done trying to do the same thing?
We are, but it is just so easy to just take care of back pain because it's such a plague in our culture. And it's so easy to only see people when they need us, when they're in pain. And it's so easy to convince somebody to just come in every once in a while when you're in pain.
So what would you say? What would you say then was the most common problem that you deal with? Would you say that it is people just coming in with back pain and they think, okay, back pain, chiropractor, or do you see more common problems?
Well, in my office, I see a variety of things. I see children that get adjusted regularly to stay well, that maybe just have little problems, but they, like if they get a cold or something, but they get adjusted regularly. But getting a cold is kind of part of the immune system being in training. And so it's not a problem if they get a cold. We just adjust them and let them go home, and deal with the cold or just, whatever it is. One of the questions I ask people in my orientation is, did you jump off the roof of your house when you were a kid? Well, I don't ask it around a kid. I only ask it around adults. But if I ask somebody that and they say yes, well, 75% of the men and 35% of the women say yes. So gravity always wins. So you jump off the roof of your house, you're 12 years of age, gravity wins. So mom says, oh, you jumped off the roof of your house. Oh, no broken bones, no blood gushing. You're fine. Well, now people that are educated to chiropractic, they go, oh, you jumped off the roof of the house, get in the car right now. We're going to go check you, make sure your spine's lined up. I don't know how to tell a 12-year-old not to jump off the roof of their house because it's part of the life experience of a 12-year-old. And that's why I don't ask it in front of a child, because I don't want to plant that idea in their head. But I know, oh, you jumped off the roof of your house, let's check you and see what's happened. Or I had a bike wreck, or I fell at school today, or just any of those things. And the kids that I see that are athletes, I see them during their practice week, and I tell them, do not crawl in here on Monday after your game, because that's going backwards. I want to see you during your practice week, so A, you prevent injuries, and B, you perform at your best. And that makes a lot more sense. And then the children are educated. Oh, don't wait until you fall apart or get injured at a game. Stay healthy so you have more fun playing your sport and don't get injured.
So it's almost like you have to educate people that are used to just dealing with, the quick fix, which is what the doctors have been prescribing as the quick fix, but the education is really the prevention. Let's prevent some of these things from happening in the first place.
Absolutely. And you're only aware of 9% of your nerve system. So whatever you perceive, it's only 9%. There's a whole nother 91% of your nerve system that you're not aware of. And that's the part that controls all the function. So if that part is clear, then your body's going to function better. But if you wait until one of those 9% of the part that you're aware of bothers you, well, what's been going on before you had a symptom? Symptoms don't come on for no reason. They come on when the body hasn't been able to fix something on its own. So what's been going on all these months and years that you've been ignoring, or that hasn't been bad enough for you to do anything about? And now all of a sudden, you can't move. And you're like, oh, yeah, I better do something about it now. So the problem comes first, then the symptoms. So if we know that there's like a short circuit in your nerve system that's there long before it manifests a symptom, then we clear it out, then the symptom doesn't ever have to manifest. Isn't that cool?
That is awesome. Yeah, it's brilliant, really. Now, you deal with the whole family. So you deal with babies all the way up throughout their lifetime. Tell me what kind of...
womb to tomb.
Say that again, sorry.
We call it womb to tomb.
Womb to tomb. I love it. Describe to me like the difference it makes in somebody's life, starting out from the womb, going all the way to the tomb. What difference does it make to their wellness?
Well, let me ask you a question, Neil. Do you have children?
I do, lots of them.
Do you? How many do you have?
I have 7.
7. So that means 7 times in your life you created the ability for life to be conceived.
Right.
Right? Magical is the best word I have for it, although it's bigger than magic. It is amazing. The most amazing thing. Now, when you went to see the doctor with your wife, with these children, when they were conceived, you got all this pamphlets and all this information, right? Which some of it probably blew your mind. The first thing that develops after the sperm and the egg come together is something called the neural tube, meaning nerve tube. That nerve tube develops into your brainstem, which sits at the bottom of your skull on the back, and where your first 2 vertebrae in your neck surround what's called the brainstem, and then you have the spinal cord. So I tell people, you were a nerve long before you had a heartbeat. Okay? So that nerve, that very first thing that developed after conception, directed single development in your children. So the nerves started growing off of that brain stem, then the body would build the chest, and then inside the chest, at the end of the nerve, blooms the heart. The body doesn't build a heart and then run nerves to it. The organs have to actually bloom at the end of those nerves. So that's why the nerve system is so important, and you should check your nerve system first when you have a health concern, not last. Because it was the nerve system that was responsible for the development of that body part to begin with.
Very, very important. So what age would you say somebody should start getting adjustments?
As soon after birth as possible. I have one daughter. I checked her probably within 20 minutes after she was born, and then probably within the next day or so, she was checked by a colleague of mine, and she's 26 now. She's been adjusted pretty much her entire life. Little things have happened along the way because she's human, but nothing huge or serious. I just adjusted her on Tuesday, and she's an adult now, but she still comes in regularly to get her spine checked and, to stay healthy regardless of how hectic her life may be. She sends her friends to me. So we see people like from when they're pregnant, when people are pregnant and their spine is lined up and their pelvis is free, birth is a lot easier.
Okay.
Because the pelvis is then free to open up easier to let the baby be born. And then, of course, sometimes, babies aren't positioned right if the pelvis is too tight and doesn't loosen up properly. And so if we can open up that pelvis, then it gives the baby a little more room to position themselves better to be born.
I'm sure that's something very important for all the pregnant mothers out there is knowing that information. Let's talk about something a little bit more controversial now. Immunizations or no immunizations?
Well, I made the choice, the educated choice, to not vaccinate my child. And I encourage everybody to get as much information as they can. Think about the pros and cons. Think about what is good science and what is not good science. Use your head and make a decision about it. The whole idea of being exposed to things so that your body develops an immunity to it is really pretty normal, right? But as soon as they inject something into the body, they've bypassed the first line of defense, which is the skin. And so the underlying idea of why you would want somebody to be exposed to, a very small amount of something so that they develop immunity is normal and natural. But how it's done and all the preservatives and how they create all the ingredients that they then inject to this baby, it's pretty disgusting. And it's a whole nother topic. So I made the choice to not vaccinate my daughter. And when she went to China in college and Italy and had no vaccinations, had no problems traveling, wasn't exposed to anything, her body couldn't fight. And she also went to a school where a lot of children weren't vaccinated. The only thing she ever really had was chicken pox when she was about a year old. She had like 3 things on her skin, one on her eyelid that I couldn't put anything on because I didn't want it to get into her eye. And so that's a teeny, weeny little, like a little scar on one of her eyelids. And other than that, she's had no problems.
Well, what I find amazing is, you meet all sorts of people that have made all different choices, and generally those people that have been going to a chiropractor for their whole life never really get sick. They have no need for a doctor. They don't get those immunizations, but yet those people that do get the immunizations, they're not seeing a chiropractor regularly. They're always at the doctor. They're always sick. And they tend to be scared of those non-vaxxed people, especially when it comes to schools.
Right. Yeah, it's really sad if you do make any decision based from fear. And when I was in school, I went to school in New York when I was younger, and then I moved to Florida when I was about 12, I think. But there were these twin girls in my class, and they always went to the doctor, and they were always sick. And I remember asking myself in 3rd grade this question, and there was nobody to ask the question to. I just asked it myself. And my question to my study, as I saw, are they always sick because they keep going to the doctor, or they keep going to the doctor because they're always sick? Well, of course, now, well, A, they're twins. So when you're in the womb and you have a sibling in the womb with you, you're not protected from your sibling. A single baby is protected from the world in the womb, right? But siblings kind of can punch and kick each other all the time. And this was back in the 60s. And I remember that's kind of when we started becoming more affluent and going to the doctors more, because the generation before that had been in the Depression and you didn't go to the doctor unless you were dying. So now all of a sudden, this is kind of where the super germs kind of started, because in the 60s, you had a cold. Well, the doctor would write you a prescription for antibiotics, even though antibiotics don't work on viruses. But they knew you would just go down the street to another doctor. And so because we were more affluent, we spent more money on disease management and, the things that really we didn't need, but we had money so we did it. It was more... it's more of a proof of how affluent we were, not just our cars and our clothes, but how often we went to the doctor. And these 2 girls had that kind of air of, I got the best kind of thing. So they thought it was great that they went to the doctor all the time. And I just thought, there's something not right about this. Yeah,
it's interesting how that trend has continued, with private health care rather than the government health care, and paying X amount to have that and going to the best doctors. People obviously want the best for themselves, but I don't think choosing a doctor over a chiropractor for regular health is the wisest decision. Let's talk a little bit more about some of the fears that people might have about going to the chiropractor. Do people like to go and get adjusted? Is that something that they like to do, or do you see people that have fears about being adjusted?
Well, I met somebody just 2 weeks ago, a young guy, and I was telling him about my office, and he said, "Oh, I would be so scared to go there." And I said, "Well, just come for consultation. You'll learn what I do." So, of course, I'd show him my table, and I show him all how the table works, and I have a handheld instrument that I use. And when they lay on the table, they're face down, so they can't really see what I'm doing. So after all the explanation that I give them, I tell them, I'm going to tell you everything I'm doing, because you can't see what I'm doing. And so I want you to know what I'm doing and why I'm doing it. Well, by the 2nd or 3rd visit, they don't even care what I'm doing. Sometimes they fall asleep on the table.
Right.
But, there is those kind of things that are in our culture, like the noise. Some people don't mind the noise, like when you adjust their neck. And some people, it would really freak them out. And so, of course, I want to know up front, are you okay if you hear a little noise in your neck or not? Because, of course, if somebody's going to freak out, then they're going to go into fight or flight, and their body's going to spasm out, and they're not going to feel good. And so, of course, I don't want to do that. I want to know everything before I adjust them. People have to get used to the idea of getting adjusted regularly. And so in my office, I don't set appointments. I just tell them these are my hours, and you schedule an appointment with yourself. So this way, if people are running 15 minutes late because they stopped to pick up their dry cleaning, or, their kids' practice ran longer or whatever, they don't have to call me and say I'm running late. They just have to come in. If I'm still at the office, they come in. And usually there's not a lot of people waiting. It usually goes pretty smoothly, during the day. And it's a lot of ums, huh? And so they don't have to, they just make it part of their lifestyle rather than having to have it be regimented. And then they have more freedom, because the whole idea is to be free and express your life, right? And not be mandated to something, but to want to do something.
Well, that's
right?
Definitely a great way to do it. I think, especially if you're, in the area and you're just passing by and like, oh, I need to go in and get an adjustment, rather than, having to book an appointment and waiting a couple of days, or, that's a great way just to walk in and get what you need when you need it.
Absolutely. And, sometimes people have varying schedules. And it's like, well, I don't care. You're making an appointment with yourself, not me. These are my hours.
So let's talk about somebody that stands out in your mind that has come to you for help. What condition were they in? What were you able to do for them, and what was the outcome that they experienced?
Like somebody recently?
Just anybody that springs to mind from your practice over the last 26 years. What kind of difference did you make in their life?
Okay. Well, I had a patient come in with hip pain. He's a 40-year-old male. 15 years ago, he did a header off his bicycle, mountain biking, landed on his head like twice, bounced on his head, and then his neck kind of like cringed to the side, and he fell off the bike, onto that. So that's 25 years ago. So he had some tests, but really not a lot. Didn't do too much about it. Went and saw a chiropractor a couple of times, but didn't really, follow through. And wasn't really a mess, except we came in with hip pain. Well, of course, I don't find a problem in his hip. I find a problem in his neck, and his head's not right. And so his hip is actually working harder to keep his posture aligned up with gravity, rather than the hip being the primary problem. And so I've only adjusted his hip. I've been adjusting him for about 5 months. I've only adjusted his hip maybe twice. And so we have this saying in chiropractic, when you step on a dog's tail, he barks out of his mouth. And so if I just chase the barking, I really wouldn't get to the underlying cause. Right? So the underlying cause of why the dog's barking is you're standing on his tail, which is the opposite end of his mouth. So sometimes the primary problem is at a different end than where the symptoms are. And so we're driven by symptoms in our culture, and we think it's the symptom. So I started adjusting him, and immediately he felt more clarity between his ears. And that's really the big thing. If you feel more like yourself, I tell people all the time, now you're 100% you. Where before, I don't want to put a percentage on it, but you were less than 100% you. And, the world wants you to be 100%, right? That's how you fulfill your purpose. That's how you live the life you were sent here to live, by expressing 100% life. So if we can keep you at 100%, that makes a lot more fun. So, of course, as I'm adjusting him, things in his spine, we call it unraveling, but it's not a bad unraveling, it's a good unraveling. Like all the old scar tissue and all the old misalignments and all the old stuckness of the spine starts freeing itself up, and then the body continues to work better and better and better and better and better. And then, of course, people sleep better, they digest their food better. They are just better expressions of life. They're better at problem solving their life because they're using all of their nerve system instead of when we're under stress. We use less of our nerve system and we are more in that fight or flight kind of thing, and we're not creative problem solvers. So you can see how having a clear nerve system is not just about getting rid of back pain or hip pain. It's really about allowing you to be who you were sent here to be. And that, to me, is the biggest thing. That's what makes my job so easy and so much fun, because I know when people leave, they are going to enter the community being a better expression of themselves.
Right.
And you can see people
happier too. Obviously, if you're feeling better, you're going to be a lot happier. And like you say, back in the community, it's nice to see a happy person as opposed to some of the miserable people that are walking around.
Correct. If you're not expressing optimal life, how could you possibly be happy?
Well, Dr. Brian, we've covered a lot here today, and really thank you for all these in-depth answers to my questions here today. If there's something that we haven't covered yet that you would really like to mention and let our audience know about, what would that be?
Well, the reason that my practice is or my practice members are called members is because I actually have what's called a membership practice. So before there was insurance that covered chiropractic, people paid a reasonable fee and got adjusted regularly. So right now, if the fee for like an adjustment, let's say, I'm just going to say $50. Mom, dad, and 2 kids, they're not coming in every week to get adjusted. And mom, dad, and 7 kids? I don't even want to do the math. So $200 a week to get adjusted to stay well, right? That's $800 a month. I mean, that might be in line with some people's budgets, but it's not in line with most people's budgets, right? So if you then kind of say, okay, this is how great chiropractic is, and then you dangle it like a carrot and say, well, this is what it costs, and people either have to mortgage their house or use their credit card, and then they're paying next year for this year's chiropractic care, that adds to stress. It has to fit in like a utility, because just like your electric and your phone, it's a monthly kind of thing. So it's a utility, meaning you need it regularly to stay well. And so people pay a monthly fee in my office, and they get adjusted. At first, I see them more often. So the first few months, that fee is a little bit higher. And it's for an individual and for a family. And the size of the family doesn't really matter, because the whole idea is keep these kids healthy for a lifetime. And you got to start with the kids. So if it's too expensive, the kids are not going to get adjusted, especially if they're not complaining. Right? Mm-hmm. They're going to come in when they're 25 to 40. And I'm going to say, what did you do when you were 12? Oh, yeah, I fell down the stairs, and I never got care. So it has to be a reasonable fee that people can afford on a monthly basis, so that it's not an obstacle. Because if people start managing their chiropractic care based on their wallet, they're not going to get the care they need to unravel all the old stuff and allow them to express optimal health for a lifetime.
Well, that's another great way to do it. I love the way that you've really done some things different with the business model in chiropractic. It's not just paying per adjustment, and you have membership, which is great, and people can walk in without appointments, and just an active member, which is awesome.
Right. The initial visit, I usually schedule appointments because that takes a little bit longer, and I do take x-rays when necessary in my office, but that's all included in the same price, so there's nothing extra.
Well, Dr. Brian, how do people get in contact with you? You're in Decatur, Georgia. How do people get in contact with your business? What's the best way? Do they call you, email you? How do they find you?
Well, they can do anything, any of those things. My office phone number is 404-370-8050, and you can also send a text to that number. My chiropractic practice is called Chiropractic for Everybody. And so my website is chiropracticforeverybody.com. And the number 4 is in between chiropractic and everybody, not the word FOR. But there is an easier way to get to my website with less letters to spell out, and that's ChiroLove, which is ChiroLove.net. And that will get you right to Chiropractic for Everybody and not have to type in so many letters. And through there, you can send a message to me. You can ask about setting an appointment. You can ask me whatever questions you need and kind of go from there.
Well, I love it. Thank you very much. I've really enjoyed this time. We're listening to Dr. Stephanie O'Brien, chiropracticforeverybody.com. And I love that. It is for everybody, not only those who have back pain. So thank you very much, Dr. Stephanie O'Brien, for being my guest on Business Authority Radio today.
Well, thank you to you, Neil, for having me. I appreciate it.
And to our listening audience, if you like what you hear, hit that like button, share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.